1 in 10 children dies from a diarrheal disease. And 80% of the diarrheal diseases take place in children less than 2 years of age.
So if they live in poor conditions, their risk of infection is higher and the risk of mortality is higher.
A disease like diarrhea has a very simple treatment algorithm, which is zinc and ORS. So with accessible treatment, if children were still dying, there had to be reasons. We discovered that the care seeking itself for diarrhea was not very high. They thought it was a part of growing up of a child and not a serious disease.
If the child has repeated episodes of diarrhea, then his nutrition is going to suffer. And the child will become malnourished. And malnutrition again predisposes the child to various kind of infection.
Any illness does take its toll on the family in terms of the care for the other siblings. Let's say the mother has to stay in hospital with the kid. Then the other siblings have to be left with somebody. And if it's the father, that means daily wages lost.
It's not that the solutions don't exist. Solutions do exist. The challenge now is how to jolt people out of their complacency.
And I think for the community to change, it's very important that the community starts owning the process.
The gaps that remain largely are in terms of caregiver comprehension.
The Building Communities of Change program was to sensitize caregivers and children on prevention and management of diarrhea.
Our flagship initiative is Gully Gully Sim Sim, which is the Indian adaptation of Sesame Street. We do this through television. We reach around 20 million kids a year.
We've seen kids talking to their parents about using soap to wash hands. They're telling parents about ORS and where is it going to be available. I think that is impact, and that's what we are hoping for.
It's those children who are surviving, and we need to help them grow and thrive, not just make it past their second birthday.
We need a social mobilization.
हम लोग कब हाथ धोएंगे? खाने से पहले और उसके बाद.
The community is saying health is our right and we demand it.
No child gets diarrhea. Not that there'll be a 10% reduction, 20% reduction, not good enough. This one thing we owe our children.